Again, thank you so much for joining us. We'll go ahead and get started. Just really quick about myself. Been around healthcare for 15 years, and that number keeps creeping up. Focused in really helping organizations in the provider community, working with the complexities, obviously, of security, privacy, as well as market research into provider satisfaction. It's a little bit about me. Been around, don't know everything, but I've got a great team behind me. So if you do have questions that stump me today, which happens on a regular basis, I hate to admit, we'll go ahead and get you some answers and get those out to you. So don't be afraid to ask the hard questions today. A little bit about enterprise health. You know, we are healthcare security and privacy experts. That's what we do. We've got technology that we've built to enable our team and our clients to successfully meet their policy, their compliance, their security goals. And again, we're very proud that as we've helped folks with their HIPAA security audits for years now, we've never had anybody fail when they're reporting to the OCR when an audit happens, right? That's something that we do stake our reputation on. We're very proud of, and we're going to keep that going. In terms of what the breadth of what we do, security services, we are a high trust assessor. We have great software around integrated risk management. So as a larger organization, if you need to manage those from multiple assessments, multiple locations or entities, it's a great tool to really enable progress as opposed to just doing an assessment, putting it on the shelf. Obviously, we're going to talk a lot about HIPAA today. That is one of the core pieces of what we do, both as a software and a service. And then, of course, NIST, great framework for managing cybersecurity. We help organizations with that all the time. So a little bit about what we do, and this is, of course, the why we do it. These keep happening, right? Breaches, attacks, all that, especially in our industry. Healthcare is so targeted, you know, because of the data that you guys have that you're stewards over is valuable. And so healthcare community is going to continue to be attacked by cybersecurity bad actors, right? We see those numbers every year. It feels like they're going up huge percentages of who's getting breached, how big the breaches are, the costs associated with the breaches. And most of those, you know, you're dealing with ransomware, phishing attacks, but we're still dealing with the mistakes and disclosures, right? How you get the information. Do you get the right information to the right person in the right amount of time, or is information going to the wrong people? Is it, you know, the lost laptop, etc.? Lots of different ways to run into problems. But that's the key, and that's really where HIPAA comes in for healthcare specifically. You know, this is about the guidance, right? Yes, it is a federal mandate for organizations, anybody that deals with EPHI, right? It guides, it is a mandate, but it's also a guide. It's the basics. It's how to take basic steps to ensure privacy of the data, security of that data once it's digitized. And again, it does result, right? There are teeth behind HIPAA and HIPAA compliance for organizations. Big things, you know, the assessments, and we're going to talk a lot about what comes out of an assessment. This is, again, a huge piece of what we do at Enterprise Health with our HIPAA One team. But the assessments are where you go in and you find where the gaps are. What are you supposed to be doing but aren't doing? Okay, it's foundation. It's identifying those risks and going the next step. Besides just identifying, as I mentioned with our IRM platform earlier, the goal that we have whenever we're working with clients is not just to identify, but to enable remediation and future compliance. Ongoing. This is a process. It doesn't end. It's not a start and a finish, right? And an assessment has a finish, but your HIPAA compliance doesn't. It is an ongoing process. And again, we always throw in, there's still that MIPS qualification piece for those organizations that are participating in that. Now, what does HIPAA mean for you and your organization? Conduct the risk assessment on the security side each year. Create remediation plans. Again, identifying gaps is awesome, but it means nothing if you can't do anything with it, or if you don't do anything with it. So get a plan in place. Have the proper policies and procedures. I like to call this intentionality, right? Just because you have the right firewall now, if it's not done intentionally, will you have the right firewall next year or next month? That's why we codify it in policies and procedures. Make sure the training's there for the staff, for everybody on the team. And document, kind of like policies and procedures, intentionality. Things have to be documented within HIPAA. It's absolutely critical that you document what's going on, including those business associate agreements. And we'll talk about those here in just a second. Breach notification, that's a big one. We're seeing a lot of class action lawsuits because somebody's messing up with the breach notification. Your stewards over data, if it gets breached, despite your best efforts, you have to notify folks and give them an opportunity to protect their data, protect themselves from an attack personally. And again, proper patient access, mentioned that earlier. When the right person requests data, get the right data to them in the right amount of time. Absolutely critical. And that's a lot. There's a lot to these. And so we'll talk a little bit about it. So I want to go through the meat of today's discussion. We went through and looked at all the assessments we do, and we do hundreds of them each and every year, okay? With organizations of all different types and sizes, from small single doc practices all the way up to some of the largest payers, academic medical centers in the country, and everything in between. So we took a look at that data and said, what are the gaps we're seeing the most often? Right, so I'm going to talk about those today, and hopefully this is really helpful for you guys and can be some valuable insight. So I mentioned business associate agreements a little bit ago. That's one we see all the time. And again, it really comes down to data stewardship. And then if you're engaging with another organization that is going to have access to the data that you are a steward of, you better make sure that they're doing the right things with it, okay? So business associate, that is everybody who's not producing data on the patient, i.e. not patient records, not a provider, also not a payer, but is helping. Your EMR vendor is not producing data, but they're certainly managing it for you. Your MSP who's helping you manage your network, well, if they have access into your data, they're a business associate. A billing company, a business associate, because again, they're not creating the data, but they are stewards of it. So what you've got to do is make sure that you have a business associate agreement signed with them that talks about what their access is, what their responsibilities are with the data, right? You've got to establish that, what data they're going to have access to. You're going to ask, or you should, this isn't a specific requirement, but I think especially when we see so many lawsuits pending right now that are based out of a business associate having a breach, but the lawsuit's against the provider, please ask for proof of compliance. Get their HIPAA security risk assessment. Get the summary of what they're doing to make sure they actually are complying with these HIPAA requirements. Unfortunately, people do sign documents even though they don't know what it is. The BAA is going to establish their requirements to report to you if they have a breach. Because again, you are the steward. You as a healthcare provider have to notify the patients, even if it's your business associate partner that had the breach, and do their job right. And again, what happens with the data if your relationship ends? Get that defined, get that in place, review it. Make sure that it's valid as you go through and it grows with your relationship with that partner. We see this all the time, that these are done incorrectly or not done at all in too many cases. Okay, gap number 2, periodic security reminders. What are we talking about here? Because we already talked about training, right? And most people really have a good grasp of the fact that you need to do annual HIPAA training and you need to train new employees, make sure they have HIPAA training. We're getting pretty good at that as an industry. But as a part of it, you've got to send out these reminders. Now, it can be done a lot of different ways, short, sweet, perfect, but throughout the year, so that HIPAA is not on the mind only once, but goes throughout the year, you got security reminders. These are the basic pieces that you need to do. Pick a topic, not broad ranging, keep it simple. Choose how you're going to do it. I've seen people, put a little message on a pay stub, send out an email to the company, send a link to a video that they've got to watch. Lots of different ways to do it. And then you got to outline a schedule. Again, intentionality, not just happen to see something and shared it with the group, but what is the timing? How often? What are you going to share throughout the year? Weekly, monthly, quarterly? What is that going to look like? If you're going to be effective, somebody's got to own it. Obviously, that usually defaults to the HIPAA officer. And then document. If you just send something out but don't keep a record of it, did you do it as far as an auditor is concerned? No. So document what you're doing. But this is a great opportunity, again, to keep your organization in a better place from the employees, right? You do all this stuff, great work, technically, keeping things in place, keeping things locked down, but then somebody shares something. Somebody loses a memory stick or grabs a memory stick and gets a virus on the system, right? Protect the patient's data. And this is a great way to keep that top of mind throughout the year. All right, security reminders, very important. Unique logins. Too many times we still see people sharing a front desk, nurse station 4 as the login for a system. I get it, it is simpler, okay? It is a simple way to do it, but it doesn't work with HIPAA. And here's the big reason. Somebody's logged into a station, everybody's sharing it, and somebody does something wrong, right? Somebody accesses something they shouldn't, somebody accidentally discloses the wrong information to the wrong person. If you don't know whose specific login that is, then how do you fix the problem? How do you report it? How do you deal with it? It gets really difficult to prove who is having the problem, and it just blows up the whole concept of an audit trail. A little bit big brother, get it, but you have to know who's accessing what. And the only way to do that is if there are unique login requirements for each user. Talking about access control. Yep, you got to have unique logins. There's also got to be a way to terminate that employee's access to PHI as soon as they are gone from the organization. Or maybe even they change roles inside the organization and don't need that access anymore. If you don't have individual unique logins, how do you control that, right? So again, access control, unique name and number. You have to have an ability to track. So your systems, your EMR, your PACS, your billing system, whatever you've got, you have to be able to track activity by specific user, okay? And again, accountability is the big piece that it comes down to. And I'm not going to get into the questions, but take a look at those. You guys can ask yourselves those questions. Make sure that you are truly on top of who's got access to what, and can you verify that? Absolutely critical. All right, cruising through these. Let's look at gap number 4, encryption. Now this gets a little technical, so well above my head in terms of my capability. I'm not a tech guy, but I understand the basics here, right? I just couldn't punch the buttons and actually dial up the right hashing algorithm. But again, we're going to mention right off the bat policies and procedures. Intentionally having the right controls as defined by HIPAA. Absolutely critical. Here SHA 256 or greater for your hashing algorithm. Really comes down to, encrypting the data, bringing it back to its original form. Because again, when it transmitted, it has to be encrypted, and when you get it on the other end, it has to not be altered. Okay, so absolutely critical. Great technology resources there to make that happen. Again, encryption level for data when it's sitting around, lots of different keys, ciphers, it's got to be difficult to get at. You got to slow down the bad actors in terms of their access to data. And then another policy and procedure, encryption when it's at rest, right? Where the data is sitting, how encrypted is it? How locked down is it? Absolutely critical to really think through these as an organization. Whether you're a large organization and you have a team, or whether you're, a really small organization and are doing the basics. Make sure you have a concept here and it's documented as to how you want to manage this. Make sure it hits the minimum levels as prescribed in the HIPAA documentation. Okay. When in doubt, go stronger if you can, right? Be a little more secure with the data if you can, if you have those capabilities. Inventories. We'll talk about this a couple times, but first we're going to talk about asset inventory. This is taking everything in your organization that's an IT asset, right? The computers, the memory sticks, the devices, the phones that access, that are the organization's phones, who accesses the data, get what they are. Descriptions, names, serial numbers, you can see there. Where it is, if you have multiple locations, where is that asset sitting each day, okay? The operating system, this is important, right? And we'll talk a little bit about this in just the next gap here, but you've got to know what device is, what it is, where it's at, and what it's running on, okay? Now, interestingly enough, aside from the physical hardware, right, like those devices that we're talking about, the asset inventory should include the software assets. The systems you have, what version are they running on, okay? What the record systems are, what your tools are that you're using. That needs to be a complete list, and it can be a challenge to maintain. I'm not going to say it's not, especially the larger an organization gets. And you can see kind of the list down there at the bottom at that minimum of what needs to be included there. It's not just busy work. Having this asset inventory enables you to secure data, to secure your patient's data that you are a steward of, okay? Maintaining the security patches is really, truly critical on the last gap that we just saw. Because if you don't know what operating system, the iPad's on, or if you don't know what version, if you're in a hospital, what the computer on wheels is running on, the cow's running on, how do you know if you've got the up-to-date patch, or that you need to look at it for a patch? Or when you get a security alert, do you know what you have? So keep that asset inventory, look for vulnerabilities, including software, obviously. The operating systems is a big place. The different applets that are running, all those pieces can be an entry point for a bad actor. Maintain a program there. Figure out how to calculate or how to receive those alerts, and know how to check against your inventory for vulnerabilities. The risks that unpatched software pose is one of the biggest and easiest ways for a hacker to get in, for them to get ransomware onto your system, okay? You've got phishing, and then you've got out-of-date systems. And again, you can see down there at the bottom that question to consider, right? Do you have the policy and procedure in place? You need it. You need to have a process. That's the procedure part of the policy and procedure. What process is your organization going to follow in order to maintain the patches? It's not random. It's not just luck. Be repeatable. Be process-driven. It's going to simplify your life and protect the data, okay? Got to evaluate, test it, get approval, get it in there, deploy it, and then test again, right? This is a process. Bigger, the more devices you have in that inventory, the more oversight and management you're going to need, but absolutely critical that you don't leave the doors unlocked. It's like you've installed all the deadbolts on the door, but then you don't actually lock them once you don't keep your patches up to date. Okay. All right, and then we're going to continue on this theme. Again, gaps 5, 6, and 7, all on the same vein, right? This is one we're really seeing a lot of lately. Okay. Where is it housed? Where is the data? What database do you have? What databases do you have that have patient information on them? Where does that sit? Is where it sits up to date? Even more critical to be able to have that inventory. Now, again, you've read this in almost every gap now, policy and procedure, requiring the documented inventory of network devices. You know, where are the connections, the tunnels, the data nodes? All that needs to be designed. Hopefully you've got a diagram, you know where stuff is, and then the model number of the connections so that you can work on them, so you know what you're dealing with if security release or security alert is released. Got to know what you're in, where the field is that you're playing, if you're going to make any moves that are proper. Okay. Well, hopefully those are very helpful to you guys to know kind of what we're seeing. The big takeaway from those gaps is you're not alone. You know, everybody is struggling with this. I was recently at a Chime event, listening to CIOs talk. They're talking about this, device security. It's a big concern, right? What's on their network? These are from massive hospitals. They've got teams. But we also talk to folks that are small. It's not as many devices, but it still takes a lot of effort for that team of one, you know, that might also be the office manager. It's really, really critical that you take these steps in an organized manner, make them fit into your routine, get things corrected, okay? Now, I want to step away from HIPAA a little bit here for just a second. Talking with a client at a large nonprofit yesterday in the compliance world. They weren't familiar with 405D. So I want to just touch on this real quick. HIPAA and compliance with HIPAA is a mandate. It is a great start, but HIPAA does not necessarily the latest, the greatest in terms of cybersecurity. Not saying it's not relevant, not saying it's not helpful, because it is, but you've also got what's called NIST CSF, or NIST Cybersecurity Framework. This is a government-sponsored framework for how to best secure your cyber data. It's across multiple industries, kind of crowdsourced, if you will, from security professionals. From that, we get Section 405D from that NIST. Now, HIPAA, in its design, stated in its documentation, it is made to follow NIST guidance, okay? So HIPAA comes from this. Section 405D is a step, if you will, okay? From HIPAA to a full NIST cybersecurity framework, 405D is not the full cybersecurity framework, because maybe you're not ready for it, or maybe your organization can't do it. And again, I want to stress, this is get HIPAA in place, then look at 405D or NIST when you want to make that next step to really securing data, okay? 405D, that's a task group, you know, like I said, industries coming together, but this one's specific to healthcare sector, okay? Really adaptive to different sizes of organizations. HIPAA, it's one size fits all from the HIPAA side. When you get into 405D, it starts specializing in the size of the organization, being more adaptive, making sure that the larger organizations that are more complex, have more risk, adhere to a little bit different or more stringent set. They also probably have a team that can help manage it. Okay. Check out the blog we wrote on it. You can go to HHS, look up the 405D. Great information here and great tools in terms of a framework to really look through and improve your cybersecurity posture. Again, get HIPAA down, get HIPAA in place. You got to have that down. And again, I've talked to large organizations, haven't done an SRA for HIPAA in 5+ years, doing good work, but haven't checked their work. They need to do HIPAA first. They're security minded. They want to improve. Let's, then it's time to take the step to 405D, potentially up to NIST, CSF as well. 405D, identified 5 top threats, put together pieces and guidance to protect your organization. Email phishing, huge, huge. This is absolutely critical to any healthcare organization. Do what you can technically, and then work on the people side of phishing attacks. Ransomware, we hear that all the time. Cities getting hit with it, hospitals, provider groups, small practices. These bad actors are good. They know how much money to ask for. They get paid really often. It's a successful business model for them. Keep them out. Loss of equipment, theft. Oh my goodness, had a poor therapist in her waning years of practicing mental health therapy. Had a single office, no employees, 1 computer. Somebody broke into her office and stole her 1 computer. She's under investigation from the OCR now because she didn't have remote wiping. She didn't have any of the pieces you need at HIPAA. She needed to get back to the HIPAA basics. Again, protect your equipment. Know what to do if something happens, because inevitably stuff happens. Intentional or accidental data loss is huge. And then attacks against medical devices. As I mentioned, those CIOs at the Chime event were very concerned with this. There's lots of funny stories from back when I was more into the medical imaging world of hackers getting in and using the computer power in what radiology would consider a basic machine of a computed radiography, a CR machine, and they were tapping into that and using it as servers to do hosting. Right, just quietly, hacked in, created all kinds of problems, okay? 405D, when you've got HIPAA, not perfect because nobody's ever gonna be perfect, but when you've got a good handle on HIPAA, take a look at 405D. I also think, as I was talking to a gentleman who works in some of the policy boards back in Washington, DC, they're working on a lot of HIPAA privacy upgrades right now, or updates. Security's coming. It hasn't really been changed since the omnibus rule, almost 10 years ago. Changes are coming to that because of its connection and its link to 405D. This is purely prediction. This is Kirk's thought here. I think a lot, if not all, of 405D is probably going to get incorporated into HIPAA before too long. So not only is it good cyber hygiene, but I think it's probably a good best practice in terms of being ahead of what's coming down the pipe. So we're going to try this here. I want to just get a picture, as I've talked about the gaps, 405D, HIPAA. I want to get a feel too for what you guys are seeing. This is kind of what we're hearing in terms of challenges that folks are facing compliance-wise in healthcare. I'm going to do my very best here. This is new for me, so I apologize, but I am going to launch a poll question. I'm going to ask you guys to answer this. Take a moment, tell me what you guys are seeing. Do any of these ring true for what's a challenge that you're facing in your organization? Just pick a couple. You don't have to do 3, top 2, top 3, but show us where your concerns are. Awesome. I appreciate the feedback, guys. Keep that coming for just another minute or so. All right, we're going to close this down in 1, 2, 3. All right, locking that in. Let me show you what your peers are saying here. All right, so this is what we're seeing. Resources and budgeting, not a surprise there. You know, especially in today's financial climate, what are we facing? Where's that budget? And I think number 2 here is also really interesting. Enterprise-wide alignment. Hear that. You guys, obviously, as you can see from this polling, you guys aren't alone. Getting everybody on the same page when they're fighting for staff, when they're fighting all their daily battles to care and to help with HIPAA, to help with compliance is not easy. Do they want to take the extra step to make sure something's safe and compliant? Or do they want to move on and get on with patient care or billing, whatever their regular day job is? Very interesting. Awesome. I appreciate that feedback, guys. It really helps understand, and hopefully it helps you guys see that you're not alone. You know, people are battling with the same challenges all the time. So to that end, I want to take a few minutes, and we won't take too long on this, but want to take a few minutes and talk through what we do at HIPAA One to help, again, identify the gaps and then really help you move on and get compliant, protect that information that you have, okay? So our solution, software driven, we combine that with assessors, with the people that do the services. It's up to date. It follows those changes that I was just talking about. Uses NIST methodology. Again, that's what HIPAA was based off in the beginning, right? Is that piece. When you're working with HIPAA One, you've got access to people that are knowledgeable. It's not just a software-only approach. You know, whether you want us to do the full assessment or whether you just want to have access to ask questions, we've got you covered. And I think one place to manage when you talk about enterprise-wide alignment, getting the remediation managed is critical, and it can be difficult. So get everything in one place centrally to aid you in managing that, but then also share the load and help facilitate the enterprise to help and to be an active participant in compliance. Absolutely a real big help. So I'm going to walk through our process and what we see as a really successful way to approach HIPAA security risk assessments and compliance and getting you the information you need. We got to gather information from you. Absolutely. The first step, where is the organization today? Where are your policies and procedures? Where is the actual implementation of those policies and procedures? How does it align, right? Again, we take a software first approach, breaking things up, getting multiple folks in the organization involved, getting right to the specialists, okay, who really live and breathe that specific area, and see how engaged with HIPAA they are. We do want to make this easy, so we have, you know, a basic English version of what we're looking for, what you need to provide in terms of documentation, but we also cite NIST. We cite the HIPAA code, and then we provide that HIPAA regulatory text, okay? Because for those that do want to deep dive into it, really want to know what it is, that's there. For those that just want to get the information in and see if they're compliant, we're going to make that easy. Repeatable process makes a difference here. Yes, no questions. If it's not compliant, if you don't have it, if it's policy and procedure related, obviously, most of these are, then we'll pop up policy here, okay? And you can use that and update it with the organization. Or you can use it, you know, to either cut and paste from, cut and paste to, adopt it anew if you didn't have a policy at all. Really simple. One of the things HIPAA does have, it is not always set in stone. There are some times where it's not reasonable and appropriate based on what you're doing as an organization. You can put that in, but as you can see in the red box, say why you're doing it. Definitely got to defend what you're doing if it's not standard for HIPAA, okay? Now, you gather all the data, you get what policies and procedures you have, you get what evidence you have that you're adhering to those policies and procedures, and then you go through and see if you're hitting the mark or not, right? Review, make sure those people that say yes actually know what they're talking about. Do you guys actually have an up-to-date policy and procedure? If you're working with the enterprise health team, we're going to do that for you. We're going to go through and check your work, make sure what you're submitting and you feel is compliant is actually compliant, and even look at what you don't think is compliant and make sure that you're not being too difficult on yourself, and maybe you are actually compliant or a lot closer than you think. We're going to let you know that, okay? So we assess, we know for sure what the gaps are now. Again, we got to identify those, and then we plan what to do with them, okay? One thing to note, as we're looking through the assessment and planning remediation here, on the privacy side of HIPAA, there are a lot of state-specific requirements that you've got to adhere to. So whether you practice in California or Wyoming, there's some different requirements there. the system will help map to that as well. So you know that you're up to date on the state-specific guidance as well, okay? Again, real simple, risks are organized, high risk to low risk. Pick a time that it's going to be completed by, assign it to somebody. If you want the system to send that assignee, again, we're talking about enterprise-wide alignment here, it will help assign and send reminders each week that they have work to do. It doesn't fully replace, you know, the HIPAA officer's harassment duties, but it'll take some of that lift off your shoulders. Okay. Target dates, you know, perfect world, you got about 6 weeks for the highs, another 6 weeks to get to the medium risks, and then 6 weeks to get to the low risk items. But it depends on your organizational capacity. Again, we talked about resource and budgeting. Some of these things could require some new systems. Talk about that. Identify that in this section so that you have a record of, hey, we're not just ignoring this, but we need next year's budget cycle to get the new server or to get the new BitLocker software, whatever it is. Document what you're doing. If you can't get there yet, document that compensating work that you're doing in lieu of having the budget, okay? Great tool, keeps it organized. It's step by step, right? Working with our team, we're gonna help you with this. But even if you're on your own and you just wanna use the tools, again, resources and budget matter. It's gonna walk you through. Take it step by step. Then we get into what you do with the data, right? You've got the gaps identified. You know that now you've got to implement a new firewall, okay? Get on it. That's the next step, is actually doing, right? The HIPAA One platform is going to help you track that. There's nothing better for keeping things moving than visibility within the organization. If it means in a small practice, the doc can log on here and just look and see if there's progress on this dashboard, because you can assign reviewer access, or if it means, you know, the C-suite is looking down on it, or you as a sponsor can actually see where things are going and who's working slow, who's working fast, and help gently remind that HIPAA is a priority, right? The HIPAA One platform enables that, okay? Action history, you're going to track it. The individuals that are working on it are going to track it for themselves, not have to relate to you and then you put it in and play the telephone game, but they're going to document it very quickly, very simply in the platform. Again, accountability. Target dates, are you meeting them? And that's the key. And you can see one of the really cool features here. I guess you can't see it, but you can download a template for the policy and procedure if that's what you're working on. Also, the context, any prior work that was done in terms of when you were gathering the data, maybe you have an existing policy that needs to get updated. If you uploaded that into the system, it's here. The documentation of the notes, if you went back and forth with my assessor on what needs to be done, all that's going to be right here where the person that it's assigned to has access without needing to wait for an email from you or from the HR manager that helped complete their section. It's already here, making it easier as you get the enterprise-wide folks involved with their limited resources. They're not waiting for emails. They're not asking. They're not having to request. It's all there. Again, much more efficient use of everybody's time. And then a final report. You've got to have this. This is your proof that you're doing it. This is your proof that you're adhering to the HIPAA policies, to the HIPAA mandate, is proofed by the report here. Now, we talk about resources and budgeting. Obviously, there's a dollars component, but there's also a time component, because as the adage goes, time is money. With our platform, you can really knock down the time required for the SRA itself. You're not going to need a ton of time from your IT guys to get you that information, or the HR director, or the facility side. HIPAA security officer, you are going to put some time into answering these questions more than the other folks. But the key is it's not hours and hours. Our reflexive question engine is not going to ask you multiple questions that are almost identical. We're not going to ask you repeats. We're not going to ask you questions that aren't relevant. You're going to answer a question. We may take away some or add some based on that response as you go through. We're conscious of the time and the resources that you have, and the system helps manage that. On the dollar side of it, on that budget side, we are running a special right now for those of you that attended the webinar or watched the recording, I guess, for those that registered. If you want to assess your privacy and your breach notification posture, we'll include that license at half price. Huge benefit. There's so much pressure on organizations right now from the privacy side. Even though it's security where you're required to do the assessment, privacy is real. Privacy fines are real, and the bad press that comes with it are very real. So if we can help you with that, we'd love to. On that end, any questions, guys, for me, happy to take them as best I can, answer any questions as we wrap up the webinar today. So I'll give you a second if you guys want to chat in any questions. Take a quick look. Yeah, we will get, we do a quick question on the slides. We will send a copy of the slides out. Exactly, we've got one of our key people is out today, but they should get out to you tomorrow in terms of the slides and a recording of the webinar. Well, while you guys are thinking, if you have any questions, do let me know. We'll just include this. If you want us to reach out and answer any questions for you directly, let us know if you'd like to schedule a call. If you're not interested right now, that's perfectly fine as well. Or if this is just education and you're just learning a little bit, that's great too. But I'll just pop this up, and those that are interested, feel free to let us know. Thank you so much for the time. I will say one of the questions we get asked the most is when to do a HIPAA SRA, that security risk assessment that's required. And the big key there, as we see those questions, is that you need to do it each year, obviously. Doesn't matter when in the calendar year. Try and pick a time where it's not going to be that hard on the organization, right? Don't plan on doing it at the end of the year if that's when everybody takes time off and you're slammed with end of year people using up their coverage. Find a good time to do it, but also think about it if you make a major change to your systems or add a location to the practice. Those are the times as well that you may choose a different time to do that. So maybe instead of waiting a full year, because of the changes you've had, you're going to go in 6 months and do another assessment. Absolutely critical, okay, to make sure that you've got those. All right, I'll just give you another second or two on the poll question. Appreciate your responses there. We'll make sure we reach out to those folks that wanted some more information. Go 3, 2, 1. Thank you so much. All right. Well, thank you guys. Really appreciate the time today. Feel free to reach out to us at any time. We'd love to chat, and if you just have a HIPAA question, let us know. We're happy to help. It's a mission of ours to help folks protect data, especially that most critical data that comes with patient care, and making sure that you guys keep the organizations up and running outside of the ransomware. So if we can help out at any point, please reach out, or if you just have questions. Thank you again for attending. We appreciate you guys coming on board today.